Hello everyone. So in this session we are going to start with the topic of epitheliums. So epithelium is a very important topic of histology and many questions in the previous year of examination has been asked from this topic. So in this session we are going to know about the epithelium types of epithelium along with the examples, along with the apical portion of epithelium and its modifications, and also the junctions of the epithelium. So all these things will be covered here. So also the previous year of questions being asked for the NEET PG INICT exam will be also incorporated in these in this discussion. So let's start with this. So first thing which I want everybody to understand, so before proceeding into the classification, it's also important that we should know what does epithelium means. So what does epithelium mean? So it is a sheet of cells which is covering the outer aspect of a solid structure, or it is covering the inner aspect of a hollow or a tubular structure. So it is made of a sheet of cells. Now, other than that, if I talk about the classification of epithelium, it is broadly classified into following types. So if we have got a surface lining epithelium, the major function which is provided is the protection and that of absorption. Glandular epithelium has got a function of secretion, neuroepithelium has got a function of sensation, and myoepithelium has got a function of contraction. So these are the major function of epithelium which you have to know, and it's very important that you should know the example of each variety. So let's start with this with the general features. So before starting with the general features, I just want everybody to know about the epithelium. If I talk about epithelium, epithelium is sheet of cell. It is a sheet of cells that covers the external surface of any solid structures and internal surface of any hollow or tubular structures, So this is the whole definition, you can say, this is a definition of epithelium. Other than that, agar hum so this was exactly, so definition of the epithelium I have already written, and let's focus. So let's focus on the different features of the epithelium. So we have completed the definition which I have already written. If I talk about the epithelium, it can be single layered, or it can be multiple layered. Other than that, if I talk about epithelium cells are attached to each other, and that the cells of the epithelium cells is attached to each other, and that attachment is attached to each other by CAM. What is that? Cell adhesion molecule. So that attachment is called as cell adhesion molecules. Other than that, epithelium rests on basement membrane. So if I talk about the component, see here, if you will see the component of the, so epithelium, as I told you, rest on basement membrane. And if I talk about this basement membrane is made of two layers, that is basal lamina and reticular lamina. So we have got two layers of the basement membrane, basal lamina being the part of the epithelium itself, and that of the reticular lamina being the part of the underlying connective tissue. Underlying epithelium, we have got the connective tissue which is traversed by blood vessels, nerves, and other than that, epithelium is having the origin, so it is arising from the three germ layers. So if I talk about epithelium is developmentally arises from all the three germ layers. What does that mean? That means it is ectodermal in origin. As the epithelium of the skin. It is endodermal in origin when we are talking about the epithelium of GI tract or gastrointestinal respiratory tract, and it is mesodermal in origin if we are talking about epithelium of CVS. Epithelium in relation to cardiovascular system. So, this is showing us that epithelium has got origin from all the three germ layers. Now, let us talk about intercellular or junctional complex. If I talk about epithelium, the individual epithelial cells has got the interconnection that is called as junctional complexes. Epithelial cells are adherent to each other by cell adhesion molecule. So, that connection to each other is called as cell adhesion molecules, and we have to understand the connection. So, if I talk about the epithelial cells connection, it is of following varieties. We have got Jonula occludens, we have got Jonula adherens, we have got macula adherens, and we have also got gap junction. So, it is important that we should know about the details of individually all these, that is intercellular junction and junctional complexes. We have to know the details of all this. Now, so done with this, now I will talk about each variety of this, that is Jonula occludens, that is the tight junction. So, we have to talk about Jonula occludens, that is the tight junction, and if I am talking about occludens, it is having no space or gap in between the epithelial cells. Actually, if you will see, if I slightly enlarge this image, so let me just enlarge, what you can see, this is the Jonula occludens, and if you will see here, what you can see, it is present near the apical part of the cell. It is present near the apical, it is present near the apical part of cells or epithelial cells, and exactly if I talk about, so they are occluded, so no space is there. So, exactly it is obliterating the intercellular spaces which is lying between the cells. So, it obliterates the intercellular space completely. So, it is obliterating the intercellular space completely, and it prevents the passage of material between it. So that and basically if we see the examples where we can see Jonula occludens or tight junction, we have got these present in the intestine and urinary bladder. Now, let us talk about the next, that is Jonula adherens. So, just I am enlarging this. What you can see, this is Jonula occludens tight junction, which is on the apical aspect of the part of epithelial cell. Just you can see lower to it, we have got Jonula adherens. So, just lower to it, you can see Jonula adherens. Now, if I talk about Jonula adherens, the location is lower to or below the tight junction, below the tight junction or Jonula occludens. And here there is a gap which is present of 20 nanometers. So, exactly please write on that. Jonula adherens. Yeah. So, if I talk about Jonula adherens, it lies below Jonula occludens. So, the location is below Jonula occludens. Okay. And also it is important that a gap is there. If I talk about, there is presence of gap. So, there is presence of gap, a gap is there, and that gap is approximately of 20 nanometers. So, अगर हम Jonula occludens की बात कर रहे थे तो वो टाइट जंक्शन था, उसमें इंडिविजुअल एपिथेलियल सेल के बीच में गैप नहीं प्रेजेंट था. बट इफ आई एम टॉकिंग अबाउट Jonula adherens, there is a presence of gap of approximately 20 nanometers, and microfilaments like actins are embedded in it. It is having microfilaments, that is actin embedded in it. Now, the next is macula adherens. The next is macula adherens, which is made of desmosomes and hemidesmosome. Okay, it is made of desmosomes and hemidesmosome. So, macula adherens, if you will see, let me slightly enlarge it. So, this is macula adherens, which is having desmosome, and half of it is called as shape is hemidesmosome. So, hemidesmosome is more towards the basal aspect, and it is, if you will see, macula adherens, it's scattered over the lateral surface of epithelial cells like a disc, and here the gap between the individual cells of epithelium is approximately 30 nanometers, and which is having transmembrane protein embedded in it. So, write down about macula adherens, that is desmosomes and hemidesmosome. So, it is scattered over the lateral surface of, epithelial cells in the form of disc, okay, and it is having a gap of 30 nanometers, and it has got transmembrane protein embedded in it. So, and if I talk about hemidesmosomes are more towards the basal aspect, and its shape is like half of a desmosome, and it is more towards the basal, close to the basal lamina as shown in the image also. Okay. Now, thereafter, let's talk about the gap junction. So, if we see the gap junction, let me just enlarge this. You can see this is the gap junction. So, agar hum gap junction ki baat karte, we are talking about the gap junction. So, gap junction ki baat karte, to it is also present laterally, as you can see, and it is having interconnection, and it causes the movement of the cells, and it is also having a prominent gap, as you can see. So, all these are very important cell junctions which have to be known to you, and that cell adhesion molecule is connecting all these cells. Okay. So, let's now I would like to talk about the surface modification of epithelial cells. Okay. So, if I talk about surface modification of epithelial cells, on the apical aspect there are certain, so exactly यहाँ पे हम apical aspect की बात करते हैं, तो और apical aspect में हमें 4 modification है. On the apical aspect we have got 4 modifications: glycocalyx, microvilli, stereocilia, and that of cilia. So, we have to one by one know about this. So, let's talk about individual aspects. So, let's talk about the individual. So, we have got all these. So, let's talk about. Okay, so let's talk about individuals. So, this is an image where I could like to enlarge. So, we can see the surface modification of epithelial cells. So, here you can see the, so this is the electron microscopic view, and we can see the minute projections are called as microvilli. Actually, the function of microvilli is increasing the absorption, and it is present in the intestinal epithelium. Stereocilia is, and microvilli is non-motile. Stereocilia is also non-motile, but it is more larger and thicker than the microvilli, and it is present in areas like epididymis, and also it is present in olfactory epithelium. Cilia are motile, and it is very important. There are certain differences between cilia and microvilli. For that, I will show you a differentiating table. Cilia are motile, and it is present in respiratory tube and that of fallopian tube, which is very important for not entering any dust particles or foreign structures, organism, and infection inside the respiratory tract. So, it is moving it out by the movements of cilia, and other than that, it is also present in the fallopian tube, where it is important for the movements of the ova, so that exactly the fertilization can take place. Glycocalyx, if I talk about, it is present in the apical aspect, it is present in the intestine, and the function of glycocalyx is concentrating the ions before absorption. So, let's see this. Now, let's talk about one by one. So, we will just, I want everybody to understand that if I talk about microvilli, the microvilli can be of two types. Either it can be of striated border, and the other will be of brush border. So if I talk about the example of striated border, what does that mean? That means that all the microvilli will have equal projections and they are arranged in a regular pattern. और अगर हम brush border की बात करते हैं तो brush border microvilli has got irregular arrangement and it is present in PCTs and it is also present in the gallbladder lining epithelium. So exactly striated का मतलब हो गया equal distribution, regular pattern of arrangement of microvilli. So I just want you to show the example here. So I just want all of you can see this minute projections which you can see here. So these very minute projections which you are seeing here, this very minute projection which you are seeing here is the microvilli. Okay, so we have seen this microvilli, and microvilli examples both striated and brush border you have to know. So let's write it down. Okay, I will give you the example of each variety, but before that I just want you to show the difference. So now you can see this is the image where you can see the stereocilia. You can see stereocilias are longer and thicker, non-motile than the microvilli. Stereocilias are present in the epididymis and it is also present in the case of olfactory epithelium. Now, other than that, you can see glycocalyx. For seeing the glycocalyx, electron microscopic view has been shown to you. So, only the microvilli is also looking longer. It is present on the apical aspect of the microvilli. It is present in the intestinal border, concentrating the ions before absorption. Cilia. If we will see here, this is HNE stain. Cilia are the projection motile and it is ciliated epithelium is present on the fallopian tube, it is and respiratory tube. So, let's write it. So, before proceeding to the next, I just want everybody to write down the examples where all these structures are present. Okay, so I just want to rub this and I just want to write the examples. So, microvilli की बात करते हैं. If I am talking about microvilli, microvilli is of two types. One is striated border. Striated border. If I talk about striated border, it is present in intestine. It is present in intestine. If I talk about the brush border, that is irregular. So, the brush border microvilli is present in gallbladder and it is present in proximal convoluted tubules of the kidney. Stereocilias are present in epididymis and it is also present in olfactory epithelium. Other than that, cilia is present in respiratory tube, mainly trachea and principal bronchus, and it is also present in fallopian tube. And if I talk about glycocalyx, which has a function of concentrating the ions before absorption, it is present in intestine. So, done with the surface modification of the epithelial cells. Now, let's also just see the difference between the microvilli and cilia. So, when we are talking about the differences between microvilli and cilia, you can see this image where you can appreciate the differences. So, if I talk about the cilia, these are longer as you can see, and this is containing microtubules. Microfilaments are present in the microvilli. They are very minute projection, also having glycocalyx, which is increasing the. So, let me just enlarge this. Okay, so if I am enlarging this, you can see the differences nicely. So, if I talk about the cilia, it is more motile, and it is thicker, longer. Approximately length of microvilli is 0.5 to 1 micrometer, but its length is 5 to 10 micrometers. 0.2 micrometers is the diameter, but this 0.1 micrometer is the diameter of the microvilli. Non-motile is microvilli, motile is the cilia. Actually, central core is containing just microfilaments, but if I talk about the central core of cilia, it is having the microtubules in it, which is arranged in 9+2 matter. Entangled particles are transported in one direction. The examples are, it is present in respiratory tube, it is present in ependyma, it is present in fallopian tube or uterine tube. Exactly what do you mean by ependyma? So, ependyma is a type of ciliated epithelium which is lining the internal part or inner lining of the ventricles of the brain and the central canal of the spinal cord. Examples of microvilli is, it is present in PCT of the kidney and intestinal epithelium. So, basically movement is the function of cilia and the function of microvilli is absorption. Now again, let's talk about the classification of epithelium. As I told you, epithelium is classified on the number of layers. It is having number of cell layer and the shape of the cells on the free aspect. So we will have either simple epithelium where we have got a single layer of the cells which is classified on its shape. So we have got simple squamous, simple cuboidal, simple columnar, ciliated epithelium, and also the pseudo-ciliated epithelium. The other is a compound which can be of multiple layered. So if we are talking about pseudo-stratified, so that is not exactly multi-layered. It appears to be multi-layered, so it is single layer only. If I talk about stratification, that means multiple layer of the cell, epithelial cells are arranged. We have got two varieties in it. We have got the transitional epithelium, which is present in urothelium, and the other variety is stratified compound. Glandular epithelium is for the contraction and secretion. Now, on this basis, let's come up with the classification of epithelium. The first one is a squamous type. If I talk about squamous type, as you can see, when we are seeing these cells, as you can see, it appears to be flattened with the nucleus here in the close to the basal lamina. Underlying flat cells are there, and if you will see the individual cells of the cuboidal epithelium, it is cube like with the nucleus in the center. So exactly cells of cuboidal epithelium is having approximately same height and that of same width, but it is more flattened. If you will see the surface view of squamous epithelium, it appears like a pavement. Now we have to know the example of each variety, which is most important and has been asked in several times in the previous year of examination. So simple squamous epithelium examples. Okay, so let's talk about the examples. So let's write examples. Examples of simple squamous epithelium. So if I talk about examples, it is present in alveoli of lung epithelium. It is present in also the part of Bowman's capsule. It is also present in the parts of loop of Henle. Other than that, if you will see the lining of peritoneum, mesothelium, if we talk about the lining of lung or outer covering lining, that is protective covering pleura, pericardium, all these are lined by simple squamous epithelium. So it is present in pleura, it is present in the lining of peritoneum, mesothelium, it is present in pericardium. So these are certain locations where we have got simple squamous epithelium. The next variety is simple cuboidal epithelium, and we have got many areas where we have got simple cuboidal epithelium. So one by one, I just firstly want you to show few examples. So you can see this is the lumen. Exactly, blood vessels and lymphatic vessels are also the examples of which I have written out. So please include the seventh example. Also the lining epithelium of blood vessels and lymphatics. Lining epithelium of blood vessels and lymphatics. All these are the example of simple squamous epithelium. Now, simple cuboidal epithelium की बात करते हैं. Simple cuboidal epithelium is present on the following areas. It is present in thyroid follicles. It is present in germinal epithelium. It is present in initial part of the excretory ducts. So it is present in ducts of exocrine gland. Mainly the initial part of the duct, I mean to tell. So these are certain areas. Also it is present in PCT, proximal PCTs, it is present in DCTs. Okay, and also the part of loop of Henle it is present. So here part of loop of Henle also it is present. Okay, so if you want you can just include one more. It is also present in parts of loop of Henle. So these are certain areas where we have got simple cuboidal epithelium. Okay, one more example is very important. 7th number I am just including here. Retinal pigment epithelium. It is also present in retinal pigment epithelium. So I just want everybody to go through all this list of the epithelium presence, which is very important for your examination. Now here I just want you to show this is the large blood vessels and the which inner lining is by simple squamous epithelium. Mesothelium, as you can see, it is appearing flat in squamous type. This is again the squamous epithelium. Other examples which you can see for the cuboidal type, we have got in the kidney tubules, yes, in the PCTs and DCTs, in the germinal epithelium, lining epithelium for the ovaries, also in the thyroid follicles. Also, if you will see the individual cells, if I just enlarge this high power view, you can see the individual cells. If you will see, the cells are cube-like with the nucleus in the center. So, this is again an example of cuboidal epithelium. Okay, this is again you can see simple cuboidal epithelium very nicely. You can appreciate if I just show the enlarged view. You can see this is the appearance of cube like, and this is present in kidney tubules. Okay, now, and here in the germinal epithelium, it is present somewhere here. This cube like epithelium which you are seeing is the germinal epithelium. So, done with this. Now, let's move on to the next one. Simple columnar epithelium. When I am talking about simple columnar epithelium, it's the individual cells will appear column like, and the cells are tall, as you can see. Nucleus is towards the basement membrane. Other than that, ciliated column. So, we have got simple columnar epithelium, but it is also having the presence of cilia. So, you can see the presence of cilia in the columnar epithelium. So, we have to know certain examples of these variety of epithelium. So, we will have simple columnar epithelium non-ciliated, we will have columnar epithelium ciliated. So, let's talk about it. Simple columnar epithelium so if we talk about the individual cells, so let me just use this so that you can understand. So, this is column like. Can you see it is not multiple layer and the individual cells are column with the nucleuses towards the basal aspect. Nucleuses is towards the basal aspect. So, such kind of epithelium is present in the case of small intestine, and columnar epithelium with microvilli, as you can see, it is present in small intestine, increasing the absorption with goblet cells. Also ciliated. So, here we are seeing, so here two examples I want to brief you. This is the fallopian tube. This is a slide of fallopian tube. We can also make out the cavity. So, you can see here the irregular cavity is seen. This is the cavity, star shaped cavity is there, and these are the lining epithelium which is also having the mucosal fold, which is also having the epithelium in it. So, these all will have simple columnar epithelium. So, you can see this is columnar epithelium with that of cilia, Actually, this is the low power view. In high power view, you can clearly see the cilia, but here you can see clearly the cilia. It is actually ependyma. So, these are cilias, ciliated columnar epithelium. What is important for us is to know the example of this. So, let's write the example of this epithelium. So, simple columnar epithelium, where it is present. So, simple columnar epithelium is present at these all location. It is present. So, it is present in stomach, it is present in intestine, it is present in appendix lining, it is present in colon, it is present in gallbladder. All these linings, okay, it is present in all these area. We have got simple columnar epithelium. Other important is simple columnar epithelium with microvilli. So, this example is, this is present in intestine, small intestine. This is present in small intestine. This is present in small intestine. Now, ciliated columnar epithelium. So, let's write the ciliated columnar epithelium where it is present. The examples are, if I talk about ciliated columnar epithelium, actually this is showing the ependyma. Ciliated columnar epithelium is present in following location. It is present in the ventricles of brain. It is present in central canal of spinal cord, Other than that, it is also present in two more examples like ciliated columnar epithelium. It will be present in fallopian tube. So, we have got ciliated columnar epithelium present in fallopian tube. We have got the ciliated columnar epithelium present in the lining epithelium of ventricles, in the lining epithelium of central canal of the spinal cord. Okay. Now, eustachian tube, actually, I would like to elaborate about eustachian tube. What is eustachian tube? It is called as nasopharynx. It is called as nasopharyngeal tube. It's called as a auditory tube. So, exactly, let me enlarge it. It is also called as auditory tube. It is also called as pharyngo-eustachian tube. Pharyngo-tympanic tube. So, it is also called as pharyngo-tympanic tube. Yeah, so so here I just want you to show this is exactly the auditory tube. So it forms a communication between the nasopharynx and that of the middle ear cavity. So you can see here it is communicating with the ear cavity, here it is communicating with the nasopharynx. So this is how it is communicating. So you can clearly see this is auditory tube, which is called pharyngo-tympanic tube. So one end will be towards nasopharynx, the other is towards the tympanic cavity. So towards the nasopharynx, towards the epithelium, towards the nasopharynx, the lining epithelium of eustachian tube is pseudostratified. It is pseudostratified ciliated columnar epithelium. And so this is the lining epithelium, and towards the middle ear cavity, if I talk about towards the middle ear cavity, it is just ciliated columnar epithelium. It is just ciliated columnar epithelium. So please note down this point. This is very important that it is having two types of epithelium. Now other is pseudostratified. So when I am using the word pseudostratified, so it's important to know what do you mean by pseudostratified. Actually, the location of the nucleus is at the different level of the epithelial cell, and it appears to be multi-layered. It appears to be multi-layered. So pseudostratified, which is also called as false stratifications. Okay, pseudostratified ciliated columnar epithelium is the lining epithelium of respiratory tract. So let me show you. So we have got pseudostratified ciliated columnar epithelium. When I am talking about pseudostratified ciliated columnar epithelium, it is present in respiratory epithelium and it will be present in trachea and principal bronchus. और अगर हम pseudostratified columnar epithelium with stereocilia की बात करते हैं, तो it is present in epididymis and vast difference. So you can just see this. Here we can see the epididymis and we can see the stereocilias are there, and here also epididymis pseudostratified ciliated columnar epithelium with the stereocilia. So this example is very important for you to understand. So I just want everybody to write this. So please write down pseudostratified columnar epithelium with cilia. That means ciliated pseudostratified columnar epithelium. This is present in respiratory tract. And to be more specific, which part of respiratory tract it is present in? Trachea, it is present in principal bronchus. Now, the pseudostratified ciliated, we have done pseudostratified stereocilia. So if I talk about pseudostratified columnar epithelium with stereocilia, so with stereocilia, which is thick, but which is with stereocilia, which is exactly with stereocilia, which is exactly non-motile, and it is present in vas deferens. It is present in vas deferens, which is also called as ductus deferens and epididymis, and the other example is epididymis. Okay, now we have completed many of the slides and many of the important examples. I would like to incorporate it with the previous year of examination questions, that is of NEET, PG and NCT examination. So this was exactly asked in the examination of previous year. The histopathological specimen taken from the autopsy of 24-year-old patient is shown in the image below. As you can see, the given structure is not found in which of the following location. So if you see the enlarged view, this is the high power view, and you can clearly see that this will be this is columnar epithelium, which is clear, nucleus is also there, and also you can see the cilia. So it is clearly see that these are cilias. Okay, these are the cilias which has been shown with columnar epithelium. So if we talk about here, the question is not talking about the type of epithelium. Basically the question is asking about the arrow mark structure. So what we have seen in this image, the arrow mark structure is cilia, and now we have to come up with the with the cilia being present on which of the following locations. So, we have got 4 options. So, the given structure is not found. So, we have to choose the odd man out. Fallopian tube, whether fallopian tube is containing cilia. Exactly. Yes. Fallopian tube, uterine tube is having the presence of cilia. So, bronchi, yes, principal bronchus is also having the cilia. So, ependyma, epididymis. So, we have got ependyma. So, we know that ependyma is lining of ventricles and the central canal of the spinal cord. So, it is also having cilia. Bronchi is also having cilia. Oviduct of fallopian tube is also having cilia. The odd man out and the correct answer here is epididymis. Why? Because epididymis is having stereocilia. Epididymis is not having the cilia, it is having pseudostratified columnar epithelium with the presence of stereocilia. So, we have got this as the right answer. I hope this question is clear to you, and if you have gone through all the examples on all the details of epithelium which I have explained, it is quite clear that the right answer will be stereocilia. The right answer in this case will be stereocilia present in epididymis. Now, I just want everybody to see here, actually pseudostratified ciliated columnar epithelium. You can see the epithelium is single, but the nucleus is positioned at its multiple level, and so the presence of nuclei at multiple level, it presents to be multi-layered, but the reality is that it is single layer only. So, it is called as pseudo means false stratification which is seen, and we get confused with it being it as a multi-layer, but the reality is, if you see in the high power, you can very clearly see the nucleuses has got different positions. So, this variety is pseudostratified ciliated columnar epithelium. Now the exactly stratified or more than one layer epithelium. If I am talking about epithelium cell, it is more than one layer, it is called as stratified. So, in that case, we have got 2 examples, 2 epitheliums we have to go for exactly the stratified. If we talk about stratified, various subtypes of stratification is there. So, one by one, and also we have to discuss transitional epithelium in this. So, let's talk about the first one which has been shown here, that is stratified. So, you can see multiple layer of cells has been shown. This is the multiple layer of the cells, but there is no presence of keratinine, but here a keratin protein is there, and if the multiple layer cells is having an outer aspect keratin protein, keratin deposition, it is called as keratinized stratified squamous epithelium. So, this is a schematic diagram to make you understand. Now, exactly I would like to show you an example of stratified squamous non-keratinized epithelium. Means there is multiple layer of epithelium and it is stratified squamous. Squamous is the most prominent outer layer which is present as a squamous epithelium, but it is not having keratin deposit. So, we have got multiple location in our body where we have got this type of epithelium. One of the example is esophagus. So, you can see this is stratified squamous layer, multiple layered epithelium, and it is present in the esophagus. Now, if I talk about keratinized, this is the slide of skin and this is the slide of esophagus. So, that in case of esophagus, we have got stratified squamous non-keratinized epithelium, and here you can see the keratin deposit is there and it is multiple layer. This is an example of skin. Now, based on the cell, it can be either stratified cuboidal, stratified columnar. One by one, we will come to each variety, but here I just want everybody, please go to the back slide only and have the example of each. So, I just want to rub this. And here one of the image has been shown, but I want everybody to write the example. So, please write on the example of stratified squamous non-keratinized epithelium. Stratified squamous, here you can write in bracket non-keratinized epithelium. So, here please write on the whole list. Non-keratinized stratified squamous epithelium is present in following location. It is present in oral cavity. It is present in nasal cavity. It is present in external auditory canal, external acoustic or auditory canal. It is also present in distal part of anal canal and vagina. It is also present in tongue lining epithelium. It is also present in esophagus. It is also present in other parts, like it is also present in the case of soft palate or palate. So actually these are certain locations where we have got stratified squamous non-keratinized epithelium. It is also present in tonsil, it is also present in tonsil. So many examples are there of stratified squamous non-keratinized epithelium. These are a few of the examples which I have noted down here. Now other than that, stratified squamous keratinized epithelium, the best example is the skin epidermis layer, skin epidermis layer. The other examples is mucocutaneous junction of the, so mucocutaneous junction is the location, mucocutaneous junction in case of nostril and that of lips. It is also present in hard palate. So actually tongue papillas, if I talk about all the papillas of the tongue, they are stratified squamous non-keratinized. But if I talk about filiform papilla, that is the odd man out, which is having keratinization. So it is having, that is filiform papillae. It is also present in gingiva. Now, these are certain parts where, and distal most, if I talk about the most terminal, distal most of the terminal part of anal canal. So, terminal, or you can say distal most, which is lying close to the skin, distal most part of anal canal. Anus, you can say, which is having skin deposition. So, it is also a type of stratified squamous keratinized epithelium. Now, based on the cell type, now as I told you, stratification is there, and we have talked about the example of stratified squamous keratinized and non-keratinized. But if the superficial layer is having cube-like arrangement, it's stratified cuboidal epithelium. If it is columnar, it is stratified columnar epithelium. So that is exactly shown in this image, and you can clearly see what is the difference. And this is a schematic diagram which is helping you to understand the difference between stratified cuboidal and stratified columnar epithelium. Now, other than that, I just want to enlarge this, and when I am enlarging it, you can see the stratified cuboidal epithelium is there, which is having stratification and cube-like arrangement of the cells. So, stratified cuboidal epithelium, you can see these individual cells will be cube-like. Now, I just want to give you the example. So, let's write the example of stratified cuboidal epithelium. The examples of stratified cuboidal epithelium is following. It is present in exocrine ducts of, sweat gland, salivary gland, okay, it is present in exocrine ducts of the sweat gland, salivary gland, lacrimal gland, all. And other than that, if I talk of stratified columnar, so stratification can also be in the form of columnar. So this is the stratification which is columnar type. This kind of stratification is found in the largest or the most terminal part of exocrine duct, exocrine ducts of whether it is sweat sebaceous and all, and it is also present in palpebrae conjunctiva. Palpebral conjunctiva. Okay. Now, once more, if I go to the back one, that is the stratified squamous non-keratinized epithelium, you can also add on two more lists. It is also present in cornea and it is also present in part of conjunctiva. So, you can see it is also present in cornea and part of conjunctiva. Now, we have done with this. Now, let's come up with the next one. Now, male urethra. Now, we do know that the urethra is having, in the males, it is having different parts. It is having the proximal part, it is having the membranous part, it is having the penile part, it is having the distal most part. So, the lining epithelium is different at that location. So, you can see exactly male urethra ki baat karte to proximal part of male urethra is lined by transitional epithelium, So, proximal part of epithelium is lined by transitional epithelium, as you can see here, which is also called as urothelium. Actually, why it is called as transitional epithelium? Because it has the capacity of stretchability. Either it can be stretched, when it is stretched, it is just 1 or 2 layers, but when it is in relaxed position, it is 3 to 5 layers. Now, here, if I talk about transitional epithelium, that is urothelium, it is present in It is present in the renal calyces. It is present in urinary bladder. It is present in ureter, and it is present in urethra. To be more specific, proximal part of urethra. Okay, now. So exactly, we are coming to this. Actually, I would also like to, if I talk about urethra, where is the urethra one? Yeah. So अगर हम male urethra की बात करते हैं, तो if I am talking about the proximal part of urethra, it is transitional epithelium, but membranous urethra will be pseudo-stratisfied columnar epithelium, or it can be stratisfied epithelium, and if we go more distal, it becomes more stratisfied. Okay, if we are going just closer to the skin, the stratisfied type is more increasing. So that means only the proximal part of the urethra is transitional epithelium. Now, otherwise it becomes, if we go to the membranous part and all, it becomes pseudo-stratified or stratified epithelium. Now, here we can see the transitional epithelium of the urinary bladder of two stages. One is the relaxed stage and one is the distended stage. So, when I am enlarging it, in the collapsed stage or in the relaxed stage, the other word is relaxed stage, it is multi-layered. As you can see, it is having 5 to 6 layers, but in the distended state it is just 2 layers, or maximum it can go to 3 layers. So, it is either 2 or the 3 layers, but it is 5 to 6 layers in case of the relaxed stage. And the outermost, if you will see the outermost cells in the relaxed stage of urinary bladder, it is having umbrella cells. It is having an outpouching, so it is called as umbrella cells. Now, let's solve few MCQs related to the topic. So, one of the MCQ of previous year of examination is transitional epithelium is present in all of the following location except. The options are ureter, the option is renal pelvis, minor calyces and membranous urethra. So, just now I have given you the description that only the proximal part of urethra is having transitional epithelium. Membranous part can either be pseudostratisfied or stratified columnar epithelium. So, it is not transitional epithelium. So, definitely the odd man out and the correct answer is membranous urethra. Renal pelvis, minor calyces, ureter, all is having transitional epithelium. Now, so exactly one of the question which was asked was about image based question, where you can see here the multiple layers has been shown as exactly. Okay, so also it is important that you should see the transitional epithelium, and you can be able to see that outermost cells can also will have umbrella cells. Okay, multiple nucleus, and this is having the outer umbrella cells, which is present in either case of the kidney, either it is present in that of the urinary bladder or ureter. So, done with this, all the best and keep studying. We will again meet in the next session with a new topic of histology. All the best and keep studying. Thank you so much.